Most CRNAs, most anesthesiologists, I believe, were largely asking the wrong questions
Mhm.
when it comes to regulatory advocacy. And this is the more serious part because this really does affect patients at the local level. Rather than trying to use the levers of government to design an anesthesia model and going to the government saying, hey, all CRNA should be independent, which is really not what most associations, they never do that actually, but that's how it gets characterized. Or
Right.
the local ASA chapters going and saying, hey, we need this model, this medical direction model, which is it's a non-starter. It's never going to happen just because of resources. We should be thinking about how do we, to some degree, make sure there's some sort of reasonable baseline of safety, but largely the state government right now is largely incompetent. They shouldn't be making decisions about anesthesia models at all. That should all be handled at the local level.
Mhm.
So even while advocacy is often, quote, characterized as pro CRNA, in reality, we should be trying to put power and control back at the local level as much as possible. Because, Brett, if you're an anesthesiologist and I'm a CRNA, you and I both know what's what. I'm going to know what you're good at. You're going to know what I'm good at. And ultimately, as long as you're not a sick person, you want to do what's best for that patient.
Yeah.
And we need to generate that kind of regulatory model, which is ultimately the government really shouldn't be regulating these things at all. Right.
Right.
And I'm not trying to shout a political
Yep.
position, but after years of doing it, this is my position. It's like, no, the
Yeah.
government shouldn't be doing anything at all. We know what
Right.
we're doing. Let
Right.
the local experts decide what's what.